Title: Measles is back, the shocking truth behind the U.S. outbreak you need to know. Intro: It was eliminated in 2000. So why is measles back? Imagine this. A disease once declared eliminated in the U.S. is making a terrifying comeback, and it's spreading fast. As of this week, the U.S. has reported over 800 measles cases, with outbreaks in multiple states, and even 3 deaths, including young children. We're not talking about a third world country. We're talking about America, right now. So, what happened? Why is this preventable virus making a comeback? And what can you do to protect yourself and your family? Let's break it down. Ground Zero, the measles epicenter in Texas. The numbers don't lie. Texas is the epicenter of the 2025 measles surge. As of this week, Texas alone has reported 597 cases across 25 counties. The outbreak began in Gaines County, a small rural area with a population of just 22,000. Over 371 people. That's more than 1% of the county have been infected. Most of the cases are tied to a tight-knit Mennonite community with low vaccination rates. 2 children have tragically died, ages 6 and 8, both unvaccinated, both previously healthy. Their cause of death? Measles-related pulmonary failure. And the danger isn't stopping at Texas's border. The virus has jumped to New Mexico, where 63 cases and 1 adult death have already been reported. Genetic testing confirms it's all connected. How far has measles spread? A state-by-state breakdown. This isn't just a Texas problem anymore. Here's where outbreaks are happening right now. Kansas, 37 cases across 8 counties. Oklahoma, 12 cases linked to Texas and New Mexico. Ohio, 30 cases with multiple counties affected. Indiana, 6 linked cases in Allen County. Pennsylvania, 9 cases, some tied to international travel. Michigan, 7 cases, 3 linked to a Canadian outbreak. And that's not all. Isolated cases have popped up in California, Florida, Georgia, Minnesota, New York, and more. Even Canada and Mexico are seeing massive outbreaks connected to the Texas epicenter. Ontario, Canada, 925 cases. Chihuahua, Mexico, 433 cases. The U.S. measles count has already doubled last year's total, and it's only April. Experts fear we could lose our measles eliminated status for the first time since 2000. The MMR vaccine, what you need to know. So, how did this happen? Simple answer: vaccination rates have dropped. The measles, mumps, and rubella MMR vaccine is highly effective. 2 doses provide 97% protection. It's one of the safest vaccines out there. But here's the problem. Since the pandemic, childhood vaccination rates have dropped nationwide, and more parents are opting out using religious or personal belief exemptions. Some communities now fall well below the 95% threshold needed for herd immunity. Even if you're vaccinated, if enough people around you aren't, you're at risk. The CDC recommends first dose, 12 to 15 months, second dose, 4 to 6 years. And yes, adults can and should get vaccinated or boosted if they don't have clear records. They were vaccinated with the killed virus version before 1968. They're traveling internationally. They're immunocompromised or in outbreak areas. What does measles actually look like? Think measles is just a rash and fever? Think again. It starts like a bad cold, runny nose, cough, high fever, red watery eyes. Then comes the rash, spreading from the face to the rest of the body, and the fever can spike over 104 degrees. But it's the complications that are terrifying. Pneumonia, brain swelling, encephalitis, blindness, deafness, death. It's especially dangerous for young kids and the unvaccinated. There's no cure, just supportive care. And the scariest part? Measles is one of the most contagious viruses on Earth. It can linger in the air for up to 2 hours after an infected person leaves the room. If one person is infected, up to 90% of the people close to them will get it, unless they're vaccinated. What's next? And why this affects everyone. You might be thinking, this isn't in my state. Why should I care? Here's the hard truth. All it takes is one person traveling from an outbreak zone to start a new cluster. Many communities have vaccination rates below 90%, ripe for rapid spread. The virus is airborne, and it's sneaky, contagious before symptoms appear. If this outbreak isn't stopped, we're looking at a repeat of SARS 2019, when the U.S. had over 1,200 cases and nearly lost its eliminated status. Public health officials are already bracing for it to last a full year, especially with summer travel and school breaks coming up. The good news? The MMR vaccine works. It's safe, it's available, but we need people to take this seriously, not just for themselves, but for their communities. Let's talk about it and do something. So now you know, measles is back, and it's deadly. It's spreading fast, across states and even countries. The vaccine works, but fewer people are getting it. And this isn't just their problem, it's ours. Don't wait until it's in your town. Check your vaccination status. Protect your family. And most importantly, talk about it. This info could save lives. So let's get it out there. Drop a comment below. Have you seen this happening in your state? Like this video if you learned something new. Share this with someone who needs to hear it. And hit that follow for real stories that matter. Let's stay informed, stay safe, and protect each other. Measles #MMR vaccine. Health alert, public health #TikTok news. Outbreak, MMR, vaccine awareness. Protect your community.